GETTYThe UK paid just over £630 million to EEA countries in 2016-17, but claimed back just £66.50, evidence of what some dub a health tourism gap, sparked demands for Britain to stop being such a soft touch, and for a fairer system after Brexit to ensure fairness. Under EU reciprocal rules, UK citizens can get healthcare in other European countries' state systems, with a bill going back to Britain to be settled. European citizens in the UK can get treatment on the NHS, which is then supposed to recoup the cost from the patient's homeland. Some of the disparity is blamed on there being far more British expat pensioners living on the continent than there are European OAPs living in Britain. There are almost about twice as many visits to the EU every year from Britain than those in the other direction. CHRISMCANDREWMartin Vickers accused certain trusts of failing to administer the system properly, at a time when the NHS is at breaking point. The government has to crack down on this and potentially save millions. Jonathan Bullock. But those explanations fail to allay long-standing criticism that UK hospitals are too lax about checking whether foreign patients live in Britain and so qualify for free care, or whether their home nations should be billed by the NHS. There are also persistent claims that some foreigners deliberately target Britain for its world-class free healthcare. Eurosceptic Conservative MP Martin Vickers, a member of the House of Commons Health Select Committee, said, "Figures such as these enrage my constituents because there is such a wide disparity that clearly points to a lack of effort by some health trusts to properly administer the system and gain reimbursement where it is due. When we leave the EU, we obviously want to retain an arrangement with our European neighbours, but it's got to be one based on a more equitable arrangement." UKIP MEP Jonathan Bullock said, "Our British sense of fair play has been abused by our European neighbours." Getty France, Ireland and Spain collectively received £551 million from the UK, but the NHS only received £28 million. At a time when the NHS is at breaking point, the government has to crack down on this and potentially save millions. Nobody's healthcare must be endangered, but we should all play by the rules. The new figures were obtained from the Department of Health through Freedom of Information requests. They showed that the UK paid just over £630 million to European Economic Area countries, which include the EU, Iceland, Liechtenstein, Norway, along with Switzerland. In 2016-17, the UK claimed back just under £66.50 million in respect of NHS treatment of those countries' nationals, a discrepancy of nearly £564 million, or some £11 million a week. The biggest gaps were with France, Ireland and Spain, who between them received £551 million from the UK for treating Britons but paid the NHS only £28 million for treating their nationals. GETTYThe disparity is partly blamed on the large number of British pensioners living on the continent. Travellers can access local free healthcare in different ways, including EHIC cards that entitle short-term visitors to state-sponsored treatment. Separately, the S1 scheme lets people living abroad apply for ongoing healthcare, usually paid by the member state whose social security system they've paid into for the longest, and this is estimated to cost the UK about £500 million a year. People covered by this include some 190,000 UK state pensioners who live in another EEA country and have their care paid for by the UK. Conversely, there are only around 5,800 EEA, Swiss state pensioners in the UK being funded by their home countries' health authorities. A separate S2 system under regulation gives patients authorization to receive care on the same terms as the local population, paid for by their country of residence. The Department of Health argued to a recent House of Lords EU committee inquiry that the current system is cost-effective for the UK, because treatment abroad often costs less than in Britain. The ability to travel and live abroad is also seen as good for pensioners, and for the tourist industry, as people can travel without worrying about healthcare bills. The department also told peers, although the UK is a net exporter of health payments under EU regulations, meaning we pay more to other countries than we receive, this access to healthcare also benefits the NHS by reducing the likelihood that people will wait and return to the UK for treatment, potentially deterring people from seeking necessary treatment are passing undetected with infectious diseases. Some of the difference is also ascribed to there being about twice as many, 53 million visits in 2016, made to EEA countries from the UK every year, compared to only 25.5 million visits from the continent to the UK. John O'Connell, chief executive of the Taxpayers Alliance, said, "Countries around the world rightly ask Brits for insurance documents when they need healthcare, and there's no reason we can't take that simple step here. The bills for treating foreign nationals are enormous, and although nobody begrudges helping those in dire need, there is clearly an imbalance. British taxpayers want to see their cash spent on frontline services, and if visitors to this country can pay for their care, then they absolutely should."